Welcome to my channel Vital Scope, your go-to hub for health, fitness, nutrition, and wellness tips. Stay informed, stay healthy, and live your best life. Introduction: Why you must listen to your pancreas. The pancreas is a small but powerful organ that sits behind your stomach. It plays a critical role in your digestion and blood sugar control, yet it's one of the most overlooked organs in the body. When something goes wrong with your pancreas, your entire system can begin to falter. The problem is, early signs of pancreatic disease are often silent or subtle until it's too late. That's why recognizing the first symptoms could potentially save your life. In this video, we'll explore what your body is trying to tell you when your pancreas is in trouble and how to spot the early warning signs before it's too late. 1. Sudden and unexplained upper abdominal pain. One of the most common signs of early pancreatic distress is pain in the upper abdomen, particularly right below the ribs. This pain may radiate to the back and often gets worse after eating, especially fatty meals. It might feel like a dull ache, a stabbing sensation, or pressure that doesn't go away. If you're experiencing persistent or worsening abdominal pain without a clear reason, your pancreas may be inflamed, a condition known as pancreatitis. 2. Nausea and vomiting after meals. Another early symptom is nausea or vomiting, especially after eating. Because the pancreas plays a major role in digesting fats, any disruption to its function makes it harder for your body to handle meals, especially greasy or heavy foods. If you're frequently nauseous after eating, or vomiting becomes a pattern, your pancreas may be struggling to do its job. This is more than just indigestion. It could be a red flag. 3. Unexplained weight loss. If you're losing weight without trying, especially alongside digestive symptoms, it could be a sign your pancreas isn't producing enough enzymes to digest and absorb nutrients properly. This condition is called exocrine pancreatic insufficiency, EPI. When the pancreas can't release enzymes, the body loses out on vital calories and nutrients, leading to rapid weight loss, muscle wasting, and fatigue. It's often a sign of chronic pancreatic disease or even pancreatic cancer. 4. Greasy or oily stools, steatorrhea. Your poop can actually tell you a lot about your pancreas. If your stools are kale, greasy, oily, or foul-smelling, you may be experiencing steatorrhea, which happens when fat isn't properly digested. This is a direct consequence of pancreatic enzyme deficiency. It might look like your stool floats, leaves an oily film in the toilet, or is unusually large or frequent. If this is happening consistently, it's time to pay attention. Your pancreas might be in trouble. 5. Yellowing of the skin and eyes, jaundice. Jaundice, a yellowish tint in the skin or the whites of your eyes, is a serious sign. It usually means something is blocking the bile duct, which may be caused by a tumor in the pancreas or swelling from inflammation. Bile builds up in your system, causing the yellow tone. If you also have dark urine or pale stools, this further points to a possible pancreatic or liver issue. Don't wait. Jaundice is always a reason to seek medical help fast. 6. Loss of appetite. When your pancreas is inflamed or impaired, it can cause a loss of appetite that's hard to explain. You might find food unappealing or feel full very quickly when you eat. This may be because of inflammation, swelling, or poor digestion, which triggers discomfort or early satiety. Combined with weight loss, this is often seen in both chronic pancreatitis and pancreatic cancer. 7. Sudden onset of diabetes or poor blood sugar control. The pancreas produces insulin, the hormone that regulates blood sugar. If your pancreas becomes damaged, it can result in insulin deficiency, leading to sudden onset of diabetes. Even people without a history of diabetes may suddenly develop high blood sugar, frequent urination, increased thirst, and fatigue. If your blood sugar is rising unexpectedly, especially after age 50, it could be a sign of pancreatic dysfunction or a tumor interfering with insulin production. 8. Fatigue and weakness. Feeling tired all the time, even when you're sleeping well? Chronic fatigue is another sign that your body isn't absorbing nutrients effectively, and your pancreas could be the reason. Malabsorption and poor digestion mean your body is starving at a cellular level, even if you're eating enough. Fatigue, weakness, and brain fog often follow pancreatic issues due to a lack of vital energy from digested nutrients. 9. Bloating and gas. Many people with early pancreatic issues experience frequent bloating, excess gas, and discomfort after eating. This happens because undigested food ferments in the gut, producing gas and bloating. If this symptom shows up regularly, especially after meals, and it's new or getting worse, it's time to consider whether your pancreas is struggling to keep up with digestion. 10. Fever and rapid heartbeat, acute pancreatitis. In more severe cases, like acute pancreatitis, the symptoms may suddenly include a high fever, increased heart rate, and severe abdominal pain. These are medical emergencies. Acute pancreatitis is often caused by gallstones, heavy alcohol use, or infections. It can progress quickly and requires immediate hospital care. If you're experiencing fever with abdominal pain, don't wait, seek emergency treatment. What causes pancreatic problems? Pancreatic issues can stem from many causes. Gallstones, which block pancreatic ducts. Alcohol abuse, a major cause of chronic pancreatitis. High triglyceride levels, which inflame the pancreas. Smoking, a major risk factor for pancreatic cancer. Genetics or cystic fibrosis, which impair enzyme production. Poor diet and lifestyle, which burden your digestive system. Understanding these causes can help you take steps to prevent damage before it starts. When to see a doctor? If you notice 2 or more of these symptoms, especially if they persist or worsen, you should consult a doctor. Early detection is key, especially for diseases like pancreatic cancer, which often goes unnoticed until it's advanced. Blood tests, imaging scans, and digestive enzyme checks can help diagnose the issue. The sooner it's caught, the better your chances for successful treatment or recovery. How to support a healthy pancreas. Protecting your pancreas doesn't require extreme steps. Small, consistent habits go a long way. Eat a low-fat, nutrient-rich diet with whole foods. Avoid excessive alcohol and quit smoking. Drink plenty of water and stay hydrated. Get regular exercise to maintain a healthy weight. Include foods like leafy greens, turmeric, garlic, and probiotics, which support pancreatic and liver health. By being proactive, you not only protect your pancreas but also improve your overall quality of life. Foods that support pancreatic health. Your diet can be your pancreas's best friend or its worst enemy. When it comes to protecting and healing the pancreas, what you eat matters greatly. Some foods help reduce inflammation, support enzyme production, and lower your risk of disease. Here are some of the top foods that nourish and support your pancreas naturally. Leafy greens like spinach, kale, and Swiss chard are rich in antioxidants, which protect the pancreas from cellular damage and oxidative stress. Berries, such as blueberries, strawberries, and raspberries, are high in vitamin C and polyphenol that can reduce inflammation. Cruciferous vegetables like broccoli and cauliflower contain compounds that may reduce the risk of pancreatic cancer. Turmeric is a powerful anti-inflammatory spice that has shown potential in reducing pancreatic inflammation when used regularly in food. Garlic and onions support immune function and reduce inflammation. Probiotic foods such as yogurt, kefir, sauerkraut, and kimchi help balance gut bacteria, which indirectly supports the pancreas and overall digestion. Whole grains and fiber-rich foods help reduce fat buildup in the body, easing the burden on the pancreas to produce insulin. Water is crucial. Staying hydrated helps maintain a healthy flow of digestive enzymes and supports all organ function. Incorporating these foods into your daily diet can not only help prevent pancreatic issues but also support healing and recovery in those already at risk. Pancreatic diseases. Know the differences. Not all pancreatic problems are the same. It's important to understand the main types of pancreatic disease, so you can be more aware of the risks and symptoms. Doesn't produce enough digestive enzymes, leading to nutrient malabsorption, diarrhea, and fatty stools. It's often a complication of chronic pancreatitis. Knowing which condition you're facing is critical for getting the right treatment. If you're experiencing signs that could point to any of these, consulting a gastroenterologist or pancreas specialist is essential. Final thoughts. Don't ignore the whispers. Your pancreas doesn't shout when it's suffering, it whispers through your body. That strange bloating, that dull ache in your back, that unexplained fatigue, They're not just random. Thanks for watching. Don't forget to like, share, and subscribe for more health tips and wellness updates. Stay healthy and see you next time.